Healthcare is changing, and Dr. Nancy RN is here for you. The topics are many, but each program stands on its own with 3 key action points for you to learn. Your guide to a healthier you in a changing world. Dr. Nancy RN.
Hello and welcome to Dr. Nancy RN. Healthy you, healthy nation, healthy world. I'm Nancy Valentine, PhD and registered nurse. And this show is dedicated to you, the healthcare consumer. And our show is hopefully going to help you navigate the healthcare system and to learn more about services that are available to you. And our guest today, I'm really happy to say, is going to really educate us on a new service that she has designed and is really offering to you, the healthcare consumer. So let me introduce our guest, Dr. Arlene Holden, and I want to tell you about her. She's also a nurse with a PhD. She's a graduate of the University of Pennsylvania and Temple University, where she earned her doctoral degree. And she's done a lot of things in nursing, and she will tell you about her journey as to what she is doing now and how she got there. In her most recent position, Dr. Holden was the nursing director of palliative care services at Philadelphia VA Medical Center. For the past 20 years, she was a member of the standing faculty, clinician educator at the University of Pennsylvania School of Nursing. While at Penn, Dr. Holden directed the Adult Oncology Nurse Practitioner Program and served as psycho-oncology consultant. That's a mouthful. And at the Abramson Cancer Center at Penn. Currently, Dr. Holden is an associate professor emerita of psychosocial oncology nursing at Penn. She also holds national board certification as an advanced certified hospice palliative care nurse and as an adult psychiatric mental health clinical nurse specialist. So I want to welcome Dr. Arlene Holden to be our guest today. And what she is going to do is tell you about, in the spirit of patient advocacy, how she has designed a program called HEAL, Holistic Enrichment of Adult Living. And she is going to tell us what that entails.
Okay.
So what I'd like Arlene to start with, though, is how you got to this point. You've done a lot in nursing, and you've been a patient advocate for many, many years. You were able to really establish a program at the Philadelphia VA Medical Center, which really made a tremendous difference in the lives of those veterans, and certainly enhanced the practice of all the people that have worked in that setting. So tell us about your own journey and how you got to do this.
Yes, Nancy, thank you. So I have worked as an advocate in my various roles within institutions, within an academic institution, within the Philadelphia VA. At this point in my life, I thought, where is my passion? What do I want to do in this next phase of my nursing career? And my passion, and it was fueled by my time at Philadelphia VA as the nursing director of palliative care services, dealing with veterans with various serious illnesses at end of life. I felt like, what is needed? There is a void out there, and it is providing high quality care to people in the home settings, has companion caregivers, and secondly, being a health advocate to those people across the socioeconomic spectrum that need help and support as they go through very serious illnesses. Mm-hmm. So I decided to start my own home care agency, which, as you just described, is HEAL, Holistic Enrichment of Adult Living. The name became very important because another unique aspect, I think, of this agency is it's not just about the physical needs. It's going in and it's assessing the total well-being of the individual at the psychological level, the social level, the spiritual level, as well as the physical level, and then doing what we can to enhance their quality of life at every level. So that was my impetus for starting. I was quite naive about the business model, but very passionate about the goals that I had and my mission.
Okay, yes. So you transitioned from your so-called regular job to say, I'm going to become an entrepreneur.
Yes.
And I'm going to fill what I think is a void out there.
Correct.
Now, you've mentioned that there are 2 arms to your business. One is companion care at home. Now, one could say there are many companion care agencies out there. So how would you say yours is going to be different?
Yes, so being a longtime nursing professor, before I taught at Penn, I was on the faculty at Thomas Jefferson University for many years. The value of nursing students, their level of professionalism, their ability to critically think, and their ability to connect with patients with an exquisite rapport, I thought, I'm going to hire nursing students.
Oh, that's a very good
going
idea.
to be the backbone of my companion caregiving service. Now, it can't be exclusively nursing students because nursing students have to go to school and they are busy, correct. But that is the heart of the companion caregiving staff. Then I have augmented that with semi-retired social workers, semi-retired nurses, and I have this wonderful staff. They're working as companion caregivers, but their level of commitment and professionalism and ability to really connect with the patient and the family is at the highest level. They are extraordinary.
I bet you get great reviews from your clients.
We do. And another component of this is I'm very hands-on. So it's a small agency. I do a very careful assessment and a full assessment of total needs of every new client, and I write up a care plan. And then I talk with the caregivers and I send out the care plan electronically, and we talk together about the needs of the client. So they go in, they take care of the client, and then they write progress notes. And of course, documentation is so important in nursing practice. So they'll write progress notes about what they did for the client, how they found the client, any change in baseline, any new symptoms. And I just had 2 emails this week from different families crediting us with keeping their family members out of the hospital because we can pick up changes. So for example, with one client, she fractured her hip. She is in an assisted living facility. We have our companions going in taking care of her 6 days a week. And just getting through the holidays was very difficult for her. Her husband died 2 years ago in December, and she had a history of major depression throughout her life. So she started to become profoundly depressed, didn't want to get out of bed, didn't want to get washed in the morning, and she had a standing appointment with her psychiatrist a month hence. But my caregivers were reporting, in fact, 2 of them called me from the home to say, you know, Mrs. Smith is complaining and saying life isn't worth living. I don't know if I can get through this again this year. It's so difficult to get out of bed in the morning. And I reported that to the family. They moved up the psychiatrist visit at my recommendation, and it was very important that they did medicate.
So really, this is very unusual because you are really monitoring these cases.
Yes.
So you've got very good people going in to do the companion care to begin with, people that are really either already designated professionals or they're professionals in training.
Correct.
So they really are, they have good observation skills and they have a sense of noting changes, which is very important in this equation. But overlaying that is your oversight and that they know that they can call you for clinical judgment.
Yes.
That's excellent.
Yes, thank you. And also the communication with the family. So keeping the family in the loop, because we have family members in Texas, we have family members in Maryland, we have family members in Kansas. So keeping them connected through these progress notes. And then I always ask them, what else ought we be thinking about? What's your feedback? What are your recommendations? And then incorporating the family input as well.
Right. I just want to make a note to our viewers that you've got a great business model for what to do in retirement, since all of us are going to have to be working a whole lot longer, and if the Social Security age goes up, everybody could really sign up to be companion caregivers for the next decade.
That's right, that's right. Boy, I could have a long list of people waiting in line to be companion caregivers. Yeah. And you know, just sort of the wealth of information you gain over the years. So some of my older companion caregivers are just phenomenal because they can be deeply empathetic about what the patient and family is going through.
Right,
yeah.
right. So that's your at-home caregiving. Now
Yes.
tell us about the advocacy piece, because that's another arm of your business.
Yes, yes. So the advocacy piece is I offer advocacy services to clients to, again, help them navigate the healthcare system, to help with care coordination, to support them in communication with their physicians, to give them tips when they're in the hospital, how to plan, how to communicate their needs clearly, and then what responsibilities they have. You know, patients certainly have rights, and they have rights for respectful and responsive care, but they also have responsibilities. Responsibilities to be very clear about their symptoms, to not downplay their symptoms, not leave out certain things they might not want to talk about or might not want their doctor to know.
So you're basically coaching the
Yes.
patient and coaching the family on how to get the most out of the healthcare system.
Exactly. And also understand the healthcare system. You go in to see your physician, your physician might have 10, 12 minutes to spend with you. You have got to get to the point. You've got to be prepared. So I accompany many of my patients to physicians' visits. I do a pre-visit questionnaire. We lay out very carefully what are the symptoms, how long have they lasted. We go into exquisite detail about the pattern of those symptoms so that the physician has full information. And we talk about key questions the patient might have, and then follow through on recommendations, how best to follow up. But that level of preparation, I think, is really critical to maximize the time you spend with your doctor or healthcare provider.
I think that's an interesting model, because most people don't think of taking a partner with them other than, say, a family member to a physician or nurse practitioner visit.
Yes.
So give us an example of how this has made a difference.
Yeah, so it's, first of all, people are well prepared. People are also, I've not seen any negative effect, although potentially there could be. But when I introduce myself, I talk about the fact that I'm here as a coach. I'm here just as a second set of eyes and ears, and to make sure the communication is as efficient as possible. And I have found physicians that I've interacted with to be very, very welcoming of that. So I let the patient take the lead, but again, I've met with that patient and we have rehearsed what needs to be asked. But if there are points of clarification, or I think the client has not sort of going into detail about all of the symptoms, I will raise that during the visit. And all in all, I think that that's very well received.
Good.
Yeah. And I also think that then the physicians realize there are less calls from 3, 4 different family members who might live out of state, because then I'm the conduit for information for the rest of the family. And it streamlines their practice as well.
So really, it's really a three-way partnership. It's a partnership with the client, family. It's also a partnership with the treater, the primary treater.
Yes.
And then you really help to knit that together for both of them. So everybody's got something that's positive that comes out of this.
Yes.
Can you give us an example of a case where you really saw how it made a difference?
Yes, I have one client who has very vague symptoms and she's gone to physician after physician, and it's so hard to pinpoint what the actual diagnosis is. And I think in more complex cases, it becomes very difficult for physicians to sort through after certain diagnostic tests have been run. So actually, she came to me after one physician said to her, "You have to hire a health advocate. I do not have the time to spend with you."
That's interesting. So he actually gave her that prompt.
Yes. So she came with a folder that was this thick with notes, and Lord, she kept such meticulous notes about symptoms and so forth, but history and tests and lab work and so forth. And I said, we have got to condense this to one page, because to walk into a physician's office with a folder this big, they'll run out the other door. So we did. We condensed it into one page. I actually put a call into the physician first to sort of review that I would be accompanying her to the visit, and that I would be giving this one page. So that physician asked me to send that via email first. So he was able to review it before we even got into the office. So he
really had a preliminary review.
Yes.
Right.
And that was so useful because he just went down point by point by point. And also, it was probably the first time this client felt like she was heard. Because I think when, unfortunately, women come in with very vague symptoms and have been to maybe 6 or 7 other providers, you know, physicians start to think, gosh, what else is going on? But that helped enormously in that visit. And there were very concrete suggestions, other specialists she needed to see, workups she needed to have. He took her off certain medications that she should not have been on. So the result of that first visit was very, very powerful. Now, unfortunately, there still are some issues that we're dealing with, but there is no question that that visit set her on a different level in terms of controlling symptoms.
It broke the cycle.
Yes.
Of just never knowing.
Yes.
At least she got, you know, to some new steps in that whole process.
And she felt supported because up to that point she felt so vulnerable and helpless in a system where nobody was listening to her.
Right. It isn't uncommon to get lost in these systems, or because a lot of times there are various specialists that are involved. You know, who is the really anchor, the coordinator of care? Now, ideally, it is the primary care physician practice, and often that includes PAs, physician assistants, nurse practitioners, but often there are a lot of things that can fall through the cracks and get lost in the shuffle. So I think what Dr. Holden is telling us about is really how having this health advocate, a role that she plays and some of her staff play, really help to hold that information together and really put a frame around it. So that you can really take your care to the next step and not sort of get lost in the weeds. But the first thing that I think most people would ask is, A, how much does this cost? And B, how would I access this role?
Yes. So for independent advocates, so I think first it's important to make a distinction. Some hospitals and institutions hire their own advocates, but those individuals are advocates hired by the system. And if someone goes out and hires a private advocate like myself, you know, fees start, and the range in this region is from about $150 upwards of $250 and more an hour. So it's an expensive service. I started HEAL as a nonprofit. It's still pending IRS approval, but once I get my nonprofit status, my goal is to then offer services to clients on a sliding scale, because health advocacy services I am passionate about ought to be available to all across the socioeconomic spectrum.
Do you see that as being embedded in any way in healthcare reform?
I would hope so, and I actually am positive about that, although I think the jury's out in terms of how far that might go. But I do think advocacy is one of the most important sort of, you know, variables in this in the Affordable Care Act. Now, how that's going to get to be operationalized, how those costs will be absorbed, I don't know.
Well, you know, the word advocacy can really get to be confusing to some, because we have identified in other discussions where all nurses are advocates. All physicians feel that, you know, on many levels they are the advocate. But that's a different role and responsibility than this kind of advocacy. Can you sort of sort out that difference?
So I don't think there's any question that nurses and physicians, advocacy is such an important ingredient in their practice. But there are also then institutional loyalties. There are practice loyalties. So when a family hires me, and not all people, clearly not all people need independent advocates, but when they do, when they hire me, I am working for that family. I have no loyalty to an institution or a particular medical or specialty practice. My primary responsibility is to help that patient navigate the healthcare system to achieve the best possible healthcare outcomes. And there is research to support that good communication and good collaboration with your physician will improve your healthcare outcomes. And that's my job. But also I'm very conscious of the cost and the burden on families. So I work as efficiently as possible. We have very clear goals about what I'm going to do. And then I teach and empower the patient and family. So I can give them a lot of important points about how to communicate with your physician, how to prepare for visits, what your rights are as a hospitalized patient, what you need to do to plan before you ever are discharged from a hospital, what are services in the community that can help, and so on and so forth. So I'm teaching people to become as independent as possible, and then I can step away.
Right. So it could be a short-term engagement. It wouldn't, I mean, even though the first blush of 150 to 200 plus an hour sounds like a very prohibitive sum of money, but it could be something where you do so much training as part of this that maybe after an initial encounter and you get people sort of on the right track, you've given them enough of the tools that they can then take it from there.
Exactly, and that is absolutely the goal. And the other thing is having someone help communicate across specialties, across providers, you know, can reduce errors. And so we're reducing, when I'm active with patients, there is the potential to reduce the burden and cost of overall care. And then the other important piece of what I do is health promotion activities. So developing a patient health record. What are the risk factors? What are your personal risk factors? What's your family risk factors? What is your lifestyle now? Your nutrition, your sleep hygiene, your exercise, safety in the home, driving safety. So we go through risk factors, and I can also educate about how best to avoid crises, to avoid problems before they begin. And I think that's another important component of what advocates can provide to families and patients.
You know, going back to where everyone considers themselves a patient advocate on some level, to this level of advocacy, it sounds to me like when clinicians say, I'm an advocate, they may be able to advocate within, you know, the organization, but it's somewhat episodic.
Yes.
Whereas you're taking it from beginning to end. You are really partnering with the patient and family to be sure that over whatever this issue is, you're going to help them solve it so that they get to the other side of that bridge.
Exactly. So across healthcare settings, across delivery models, exactly. And then people can always call me back in. So say the initial crisis has been averted, I have given clients the tools that I can give them at that point in time. If there is another issue, they can always call me. But what I have found so far is I have advocates. I just started HEAL last April of 2012, and I have clients that have been with me since April. So that, and clearly there are some points in time when I'm more active with them, but I have a cadre of health advocacy clients that I've been working with continuously.
That's great. So it's not like you begin and end the relationship. You may begin and end an engagement, but then that relationship can be ongoing.
Can be ongoing, right, correct.
Now you're located here in Bryn Mawr. What is the scope of the territory that you are covering?
Yes, so we deliver care to people in Philadelphia, Montgomery, and Delaware counties.
Okay. Yes. And how would people find you?
So I have a website, which is www.healconsultants.org, and so many people find me on the web, actually, and actually many family members from across the country will come upon my site and then contact me.
Yes.
And also certainly by word of mouth and the professional network as well. Yes.
That sounds great.
Yeah.
I'd like to get back to the staff that you have for that companion care. What kind of feedback do you get from them?
They love what they're doing. And in fact, I have employed some graduate nurses. So they graduated, they were waiting to take their NCLEX exams, and they said, you know what, I need more experience. So they've worked for me. And I have some even after they become RNs, and these are, young men and women, continue with clients because they developed this wonderful relationship with the client. And they still give care and juggling, their full-time RN job, but still feel so committed. So I've gotten very positive feedback from the caregivers that I've employed. So I think it works both ways. It's so rewarding to them, the relationship with the client, and the client deeply appreciates the care and compassion of the caregivers.
I bet,
Yes.
I bet. Well, what do you think is the forecast for the future? We're all aging. There are going to be more, complexities in healthcare. Do you see this as a growing market, or in contrast, do you see all the work that hospital systems are putting into transitions in care and helping people transition, successfully? Where is this all going to come together?
Yeah.
What do you sort of see as the trajectory?
So in my view, with the aging baby boomers, the complexity of care, and also the deep fragmentation of care right now, we can all hope that will improve. But in the near future, I think both is going to be necessary. I think health advocacy is critical. And there are national organizations now creating standards, creating codes of ethics. And I think this will grow exponentially because there will always be a need for advocates, no matter how efficient the healthcare system. Teaching, coaching, and as you pointed out, being this presence across systems and venues of care will always be important.
Right, right. Yes. Well, it sounds like you've really put something together that really has a lot of potential. You're working now, you're really servicing many people, but you see it really growing. And I think more importantly for our viewers, they know that there are people out there that really will have their best interests at heart and that they can get a hold of them. So no one really has to drown in the healthcare system, even though sometimes when you're in it, it can look daunting and overwhelming. You're trying to take all that so-called noise out of the system and really make it more navigational for people.
Yes.
Well, I want to thank Dr. Arlene Holden for her presentation today and for sharing with us her excellence and her trailblazing efforts in really developing HEAL. She has got a lovely little brochure here. I think that she's also having a wonderful service for many of the young nurses who have graduated, where right now in certain areas of the country, certainly here in Philadelphia, there are often a lot of push-pull in getting a job because there are not enough jobs for some of these graduates. So I think it's fantastic that you're giving the chance really to get some home care experience and really get them on the way to their careers. So again, thank you very much, Arlene.
Thank you, Nancy.
It's been a pleasure to talk with you.
It's been my
Thank
pleasure.
you. Thanks for joining us today.
I hope you enjoyed our conversation today and that the information will help you in meeting your health goals. Catch this program and other conversations on the website, drnancyrn.com. Or you can write to me as well. I welcome your comments and feedback. Thank you for listening and join us again. And remember, with health, all things are possible.